Hello, my name is Quasim and I'm an intensive care consultant at Glasgow Royal Infirmary. INSPIRE stands for Intensive Care Syndrome Promoting Independence and/or Return to Employment. And it's a 5-week rehabilitation programme co-designed with patients, basically to empower them to take control of their own health and well-being.
Hello, my name is Jane and I'm the Programme Manager for INSPIRE. The main benefit of INSPIRE is to offer people the opportunity not just to survive, but to really thrive.
We know that patients struggle a lot after intensive care and really don't know how to get the best quality of life. When people have told you that you're lucky to be alive, it makes you feel that you can't complain about things that seem apparently minor, but they're very important to lots of us. And so we recognised that there was this real gap, not only between intensive care physicians and clinicians and other secondary care healthcare professionals, but then the gap would be even bigger between primary care. And really the only people that knows what's gone on in ICU are ICU professionals.
My name's Mick, McGowan. I was in intensive care and high dependency unit last August for 4 weeks. So I attend the INSPIRE clinics each week and assist with making teas and coffees, and other occasions I'll be asked to have a sort of specific conversation maybe with a particular patient about how my recovery has progressed and what issues I particularly faced. So, it gives them encouragement to see, some way down the line, so to speak, that, they could be feeling a lot better.
So there are some key components to the INSPIRE programme. So in week 1, we look at setting goals with the individual and look through the concerns checklist of what's most important to them at that point in time. They will have a one-to-one with a consultant and with a nurse from ICU, pharmacist, physiotherapist. We have group psychology sessions, and sometimes we will split the individuals who were former patients with their carers, so that sometimes family find it difficult to talk about certain things with their loved ones. So it's easier for them to talk amongst themselves.
And really it was on the basis of that patient and family council where they told us what their difficulties were. They all thought that when they got home they'd be fine. Life would be great. And then what happened is they get home and about a month later they realise they're still weak, and they're now avoiding people in the streets that know them and that are their friends because they feel different, they look different. But they also then can't communicate with their family and friends about it because they've put their family and friends through so much that they don't feel that they want to lay that burden on them anymore.
I think the needs of individuals who are going through INSPIRE are quite different, and I think one of the benefits of INSPIRE is that it's tailored according to individuals' needs.
I think why INSPIRE is so important is because we not only look after patients, but we also look after the family members as well. So by the time their family members got out, they're sleep deprived, they're exhausted, and now they're a carer. But the biggest thing for me is the social problems. Addictions are really problematic for a lot of patients, and it's trying to put them in touch with services to allow them to turn their lives around as well.
So one of the other important aspects to the programme is linking people with community sources of support. So we have Citizens Advice who come in and provide money advice.
The experience and the information that you get is more focused, more relevant to the experience they've been through. So it helps you put the whole experience into a context that's more realistic, and you don't get quite so frustrated.
I think it improves self-esteem. I think it makes them realise they're not alone, and the new way of their lives being doesn't necessarily mean it has to be an awful quality of life, and I think that's what we provide them with, that hope.
And the Health Foundation Scaling Up funding has really allowed us to explore how INSPIRE might work in other areas. So what's the impact of implementing INSPIRE in a different geographical area? For me, I think it's been really important to have an independent sounding board, so a space to reflect on what's happening within the programme that is independent to the programme itself and to our funders.
So I think by working with patients and finding out what the gaps in our service is, programmes like INSPIRE can help, because I've now seen why we have such a high DNA rate or readmission rate, and it's generally speaking not medical, it's often social and healthcare. So I think if we can show that the gaps in the social care affect healthcare, then that will be hugely beneficial to the NHS, because it's much more expensive to keep someone in a hospital where patients generally don't want to be, rather than trying to bolster up services in the community, which is where they do want to be.